Hi everyone, how are you? I am from Eustachian audiology. We will talk in this video about tinnitus, the most common problem in the ear, and a lot of people are complaining of this. What is the causes? What is the management? We will see all in the video. If this video is good, please like the video and subscribe in the channel. First of all, we will tell you what is the definition of tinnitus and what is the cause of it. If it's only from the ear or maybe other side outside the ear, from pain, from blood vessels, from any other side rather than here, and we will talk about management, drugs, hearing aid, physiotherapy also, we will talk about that. Okay, we will continue the next talk.
Hello everyone. For anyone who complaining of tinnitus, we will discuss this matter in details from the start till the end. Tinnitus definition, classification, objective and subjective theories, evaluation and treatment. Tinnitus is perception of sound in the absence of external stimuli. You hear sound in your ears without external sound, meaning buzzing, roaring, clicking, pulsatile, ringing. May be unilateral in one ear or bilateral. May be originate from ears or around the ear. $40 million affected in United States by tinnitus. 10 million severely affected, most common in 40 to 70 years old, more common in men than women. Objective, that heard by examiner. Subjective, heard by only the patient. Pulsatile mean the tinnitus come only with the heart pump. Every heart pump you hear the sound in your ear. Maybe vascular or hyper blood flow. Objective may be cardiac murmur, pregnancy, anemia, thyrotoxicity, back disease, intracranial hypertension, arteriovenous malformation, vascular tumor, venous hum, atherosclerosis, ectopic carotid artery, persistent stapedial artery, dizziness, jugular pulp, or vascular loop. Arteriovenous malformation, the main complaint: headache, pulsatile tinnitus, papal edema, discoloration of skin or mucosa. Vascular tumor, glomus tympanicum or jugular tympanicum. Tumor in the middle ear, decreased with carotid compression. When we compress in the site of the lesion in the neck, the tinnitus will be decreased and accompanied by conductive hearing loss. Glomus jugulare, conductive hearing loss and pulsatile tinnitus. Venous hum in intracranial hypertension, since jugular pulp, transverse sinus partial obstruction, increased cardiac output in pregnancy, thyrotoxicosis, and anemia. Intracranial hypertension, symptoms: dizziness, headache, visual disturbance, oral fullness, hearing loss. Muscular causes: palatal myoclonus. You hear click sound, tick, 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 rapid, intermittent, contraction of tensor palati and levator palatini muscles. May be associated with multiple sclerosis, neurological disorders, small vessel disease, and tumors. Treatment: muscle relaxant, botulinum toxin injection. Idiopathic stapedial muscle spasm, rough crackling sound, exacerbated by outside sound, brief and intermittent. Treatment: avoid of stimulant, muscle relaxant, surgical division of tensor tympani muscles. Patulous Eustachian tube, roar sound, change with respiration, lying down or head independent position provide relieving. It need an investigation called tympanogram, which show change in compliance with respiration. The treatment is weight loss, radiation of nasopharynx, and some injection treatment as Teflon or gel foam injection. Subjective: presbyculosis, noise exposure, Meniere's, otosclerosis, any cause that cause hearing loss. Conductive hearing loss or sensory neural hearing loss. Conductive as wax impaction, otosclerosis, middle ear effusion. Treatment will be the cause. Subjective as hyperactive hair cells, chemical imbalance. Central nervous system mechanism, recognition of central pathway with hearing loss. Drugs that cause the tinnitus: aspirin, asposite, acetyl salicylic acid, quinones, loop diuretic as Lasix, chemotherapy, anti-inflammatory, antibiotic, aminoglycosides, antidepressants as heterocyclines. Evaluation will be history taking, quality pitch loud of tinnitus, onset, aggravating factors, infection, trauma, noise exposure, medication used, medical history, hearing loss, vertigo, pain, family history, impact on patient. Complete and head and neck examination, general examination, otoscopic examination, also light exercise to increase pulsatile tinnitus, light pressure on the neck, Valsalva maneuver, which closing nose and mouth and make air pressure on nose. Burton audiometry, speech discrimination, tympanometry, Eustachian tube function, acoustic reflex, masking level. All this called audiometry, which will give us the definitive cause of the tinnitus. Okay, maybe we will need this is a picture of tympanogram. May we need some other as blood chemistry, thyroid studies, lipid profile, FETA absorption test. Also we can need a CT scan for brain and ear. Also this is picture of glomus tympanicum in CT scan. Also we can need MRI in some cases. So we can say that tinnitus is a symptom, not a disease. So we should know the cause of this symptom, and then we will manage it. If there is hearing loss, we will treat it by medication or hearing aid. If there is palatal myoclonus, we will manage it